If someone said that all psychiatrists do is fill out paperwork and give medications, I would ask them to visit one of our many psychiatric intensive care units in the United Kingdom and see what psychiatrists actually do. They need to be experts in lots of different domains. A psychiatrist has certain roles in terms of being a leader, but so do the other team members. So the psychiatrist needs to create an environment where everyone is empowered to do the best that they can for their patients. That's about clinical leadership. What a psychiatrist does in a psychiatric intensive care unit is in some sense not that different to what every other team member does. Make sure we provide high quality care. To be able to really care for your patients and do the right thing, you often have to think outside the box. You often have to have a can-do attitude and think differently. And in my experience, that's what PICU teams do. They think outside the box. They have to constantly innovate. At times it can be incredibly inspirational to listen to patient stories, carer stories, to genuinely, in a very authentic way, use that to inform policy and practice.
PICU, I'm not the traditional pharmacist behind a chemist. I'm a pharmacist that's involved with the multidisciplinary team, and we discuss therapy, what's the best way forward, medications, talking with patients. I do sometimes do groups with patients as well. So you might get people discussing medication between them. As a pharmacist, I'm there to make sure that it's the right medication for the right patient, and that if side effects are happening, that maybe the dose goes down, or that we think about other medications. But it's opening ideas, and it could be I might be saying stopping a medication as much as I am saying starting, increasing a dose as well as decreasing, adding another medication. All of these are conversations that I will have.
The psychiatrist does.
Patients teach me lots about their medication as well, because I don't take the medication. They're the people that are taking the medication, and they can tell me what's happening to them, how it's affecting them, and that's really important.
The main thing that I do as part of my role is run ward activities. So we have quite a structured activity programme that I've made alongside the patients and staff members as well. We run lots of different groups, so things like art and creative expression groups. We do food preparation, all kinds of things. There's also opportunity for one-to-one sessions as well. Some patients might not be at a stage where they're able to work with others in a group, or they may not want to. What I try to do is just to offer, a bit of a sense of home maybe, and just being able to offer something to make people feel like they're still themselves. Being an occupational therapist is such a meaningful career. I just think it's so important for people to be independent in the things that they like to do and the things that they need to do to function every day. Just having things to do is absolutely crucial in our everyday lives. Doing is what makes us who we are.
I am currently an assistant psychologist working for a male and female PICU in London. My job entails running groups. Mostly it's low intensity psychology, and I also attend management rounds. I attend ward rounds, so working with doctors, nurses, OTs, managers. Sometimes I do one-to-one with patients as well, to discuss kind of the recovery, if they're having any kind of problems or any kind of concerns, but looking at it from a psychological perspective. One group that I run, which I call the Wellbeing Group, we explore different topics, whether it's effective communication, self-compassion and self-esteem, managing distressing emotions, sometimes as basic as sleep. So we run that on a weekly basis on both the male and the female PICUs of separate sessions. What's also been important in my role is also kind of teaching the other healthcare professionals about my skills, about my knowledge and what I have, and how we can contribute to caring for those on a PICU setting and for that client group to make sure that they have the best possible care. I'm very hopeful, and I think everyone has potential, and I think that's what keeps me going with my role and with my job.
One of the reasons that I chose to be a mental health nurse is the diversity of being a mental health nurse. You know, my roles and responsibilities are incredibly varied. It's about assessment, so I look at someone and I meet with someone and think about what they might need in order for them to get better. It's about communication, having an idea and knowledge around medication, having an idea and an evidence base around what approach is needed to each individual, and it's about honesty, transparency, warmth, good sense of humour. I might lead a ward review, I might meet with someone's family, I might organise the rota, but it's really important for me that each day I find some time to go out, sit down, have a cup of tea, chat about the weather. I don't want it to all be about someone's mental health or their illness or how unwell they feel, and I hope it never feels like I'm doing something to a human being, that we're doing it together. But I think for me, working on PICU, I really got a sense of how resilient human beings can be. And one of the things that I enjoy most about psychiatric intensive care is that we do see change and we do see people get better. I never lost, and I hope I never do lose, the absolute privilege of working with someone at that point in their life.
You're in a very confined environment on a PICU ward. Things that you're used to, like your social media, things like that, your friends, your family are removed from you. Boredom can be a really big thing. As an activities coordinator, I work within the MDT, and my job is to provide a mixture of activities on the ward for the patient. Some to try and look at recovery, and some just for fun. It might be that you start with a very basic cooking group, and that progresses onto cooking your own full lunch. You know? So I do get to be a part of that journey with patients. I can be, in some respects, the yes man. So yeah, come along, let's do this, let's do that, you know, and that's really good. And I think my role as well, there is an element of my shared experience and sort of role modelling, and just sort of being a nice guy and being able to communicate on a very normal level. To see people progress and to see the journey is very exciting for me.
As a ward manager, the key components really of delivering my role effectively would be trying to inspire the team, trying to work with what I would describe as a relatively flattened hierarchy. We want to all align ourselves, if we can, with the patient group, not come across hierarchical in fashion where possible. We regularly involve activity coordinators, we regularly involve obviously doctors, occupational therapists, physiotherapists, and psychologists, and a range of others that I may have missed. My job would be, there's a lot of coordinating that, but also making sure that staff have access to regular supervision, are able to perform their job to the best of their ability, which, you know, there's quite a lot of looking out for people required. It is an intensive job, and quite a challenging one, well, a very challenging one in my opinion, but very rewarding at the same time. Working on a PICU has done a lot for me as a person. I think I've grown into a more robust and resilient individual, really. The ability to attempt to put yourself in somebody else's shoes in what is really quite a dark part of someone's life, and you often try and carry the hope for people through those difficult times. And I think it does really give you a huge perspective on life in general, let alone doing a job. But it gives you a sense that the career you are you're involved in is actually really making a difference for people, especially obviously when you see good results, people using leave, people going home and generally recovering from a serious mental disorder.